have the honor of welcoming Honorable President of India, Srimati Droupadi Murmu ji, and Honorable Governor of Maharashtra, Shri Ramesh Bhai ji, to IIT Bombay for dedicating to the nation the first indigenous CAR T cell therapy. I request Director of IIT Bombay, Professor Subhashis Chaudhary, to kindly address the audience.
Honorable President of India, Srimati Droupadi Murmu, Honorable Governor of Maharashtra, Shri Ramesh Bhai, Professor Sudeep Gupta, Director TMC, distinguished invitees from the corporate and the academic world, faculty colleagues, students and friends. I extend a warm and cordial welcome to all of you to IIT Bombay. Today, we have all gathered here on this very momentous occasion to celebrate an important milestone in the journey of cancer care in our country through a deep tech engagement of IIT Bombay. We feel deeply honored and privileged by the august presence of the Honorable President at this event to dedicate this technology to the country and to the world. The development of this therapy for our cancer patients in India, called as CAR T cell therapy, is a huge achievement for our country. It places India firmly on the global map of cell and gene therapy. We can take pride in the fact that India is now one of the very few countries in the world that can make its own cellular therapy. This is a testament to the efforts of several scientists, doctors, nurses and others who worked together relentlessly over the last decade to achieve this goal for our patients. It is not a coincidence that the therapy, which requires a stellar research in engineering and cancer care, should come out of a collaboration between two global pioneers, that is IIT Bombay and Tata Memorial Hospital. The two institutions have worked together on this complex, interdisciplinary project and delivered world-class and hugely impactful outcomes that will touch millions of people who need cancer care. IIT Bombay is one of the pioneering institutes for engineering in India. It has the best of the minds working day in and day out in this beautiful campus to bring solutions for India in various fields such as design, construction, AI and health. And IIT Bombay is at the forefront of excellence in education, impactful research and its translation to create social and industrial impact across all facets of the nation's growth. Likewise, the Tata Memorial Hospital embodies excellence in cancer care, which has built its reputation as a premier research center in cancer with several innovations. What is common between two of the centers is the deep and strong desire to develop indigenous solutions to local healthcare related problems, placing India and Indians at the heart of this work. Just like Chandrayaan-3 that launched India's entry into the elite space club about 8 months ago, the CAR T cell therapy heralds India's entry into the cell and genetic engineering group. Both of these technology milestones have achieved similar impactful results at the global level, but at a substantially lower cost. It's about only 4 crores in India per patient in the West versus only a handful of rupees 30 lakhs as compared to 4 crores in the West in India, and has helped leapfrog India into the group of technologically advanced countries. Presently, the CAR T cell therapy is in use and has been approved by the CDSCO for patients with different types of blood cancers. This treatment will positively affect the lives of at least 20,000 Indians every year. I also know that cell and gene therapies are being actively studied for other diseases such as other types of cancers, autoimmune diseases, and some blood disorders such as sickle cell anemia and thalassemia, which are quite common in the tribal areas in India. We hope that the CAR T-cell therapy as well as several similar therapies will now be developed further and accelerated to address such diseases prevalent in the country as well as globally. I am delighted to say that some of the patients who benefited from the invention are among us today. I request Professor Rahul Purwar, the team leader who's behind this innovation, and the patients who benefited from this to stand up and acknowledge the Honorable President. It is important that this therapy be made available to all of those in need, not only in the country but also to several other countries who do not have the technical know-how. I urge this eminent research team to find ingenious ways to proliferate this therapy and touch the lives of millions of patients in the country and abroad. In conclusion, I extend my warmest congratulations to each and every one who have helped this development and wish them even greater success for the future. Needless to say, IIT Bombay will continue to strive hard to show that more such type of innovations come out of this institute. Thank you and Jai Hind.
औद्योगिक संस्थान मुंबई सुरंग में 550 एकड़ में स्थित है, जिसके में सर्वश्रेष्ठ अनुसंधान, बुनियादी ढांचे, कक्ष भारतीय प्रौद्योगिक संस्थान मुंबई सुरंग में 550 एकड़ में स्थित है, जिसके दोनों तरफ विहार और पवई झीलें और चारों ओर हरी भरी पहाड़ियां हैं। ये पूरी तरह से आवासीय परिसर है, जिसमें सर्वश्रेष्ठ अनुसंधान, बुनियादी ढांचे, कक्षाएं, छात्रावास, खेल और चिकित्सा सुविधाएं हैं, जो उत्कृष्टता की खोज में बेहतरीन समझ रखने वालों को एक साथ लाती हैं। आज 31 मार्च 2023 तक संस्थान में लगभग 5,972 अवर स्नातक छात्र, 3,334 स्नातकोत्तर छात्र, 3,680 पीएचडी शोध छात्र हैं। इसके साथ ही भारतीय प्रौद्योगिकी संस्थान मुंबई में 16 शैक्षिक विभाग, 8 शैक्षिक उपाधि प्रदान करने वाले केंद्र, 3 विद्यालय तथा 4 अंतर विषयक कार्यक्रम हैं और 1 शैक्षिक परामर्श, 1 शैक्षिक प्रसार आउटरीच शिक्षा और अनुसंधान केंद्र, 5 सेवाएं प्रदान करने वाले केंद्र, 18 अनुसंधान एवं सहायक सुविधाएं प्रदान करने वाले केंद्र हैं, 4 अनुभाग 8 कंपनियां, 718 पूर्णकालिक संकाय, 70 सहायक संकाय, 5 प्रोफेसर ऑफ प्रैक्टिस और 65 अभ्यागत प्राध्यापक मौजूद हैं। पिछले 5 वर्षों में भारतीय प्रौद्योगिकी संस्थान मुंबई को इसकी अनुसंधान एवं विकास गतिविधियों के लिए 1,683.43 करोड़ रुपए की अतिरिक्त निधि प्राप्त हुई है। वहीं भारतीय प्रौद्योगिकी संस्थान मुंबई को शिक्षा मंत्रालय द्वारा उत्कृष्ट संस्थान का दर्जा भी दिया गया है। इसे अनुदान के रूप में 572.764 करोड़ रुपए मिले हैं। इसमें से 415.10 करोड़ रुपए अनुसंधान बुनियादी ढांचे के विकास के लिए रखे गए हैं। प्रधानमंत्री के आत्मनिर्भर भारत को ध्यान में रखते हुए भारतीय प्रौद्योगिकी संस्थान मुंबई में अनुसंधान एवं विकास का ध्यान स्टार्टअप और भारतीय कंपनियों को संधारणीय प्रौद्योगिकी प्रदान करने पर है। वहीं सरकारी सहयोग से उद्योगों और भारतीय प्रौद्योगिकी संस्थान मुंबई के बीच विभिन्न सार्वजनिक निजी भागीदारी पीपीपी प्रयोगशालाओं में उपलब्ध प्रौद्योगिकियों को तैनाती योग्य वाणिज्यिक उत्पादों में परिवर्तित करने में सहायता की है। अपनी स्थापना के बाद से भारतीय प्रौद्योगिकी संस्थान मुंबई ने एक नए राष्ट्र के लिए प्रौद्योगिकी और औद्योगिक आत्मनिर्भरता प्रदान करने की दिशा में कार्य किया है। 60 वर्षों के बाद हमने अब अभियांत्रिकी, शिक्षा और अनुसंधान के क्षेत्र में वैश्विक स्तर पर अपनी पहचान बना ली है। भारतीय प्रौद्योगिकी संस्थान मुंबई का प्रौद्योगिकी समुदाय यानी साइन शैक्षिक जगत के शुरुआती इंक्यूबेटरों में से एक है। यह है प्रौद्योगिकी आधारित उद्यमिता के लिए बड़े पैमाने पर समर्थन प्रदान करता है और अनुसंधान गतिविधि को उद्यमशीलता उद्यमों में बदलने की सुविधा प्रदान करता है। भारतीय प्रौद्योगिकी संस्थान मुंबई रिसर्च फाउंडेशन उद्योग शैक्षिक सहयोग को बढ़ावा देने वाला एक नवाचार केंद्र है। साथ ही ग्राहकों और सहयोगियों के साथ हमारा सहयोग ज्ञान और संसाधनों के दो तरफा प्रवाह को सक्षम बनाता है।
We impart education that transforms students into innovators, researchers, entrepreneurs, and leaders of tomorrow so that they can take care of real problems in the outside world. We will continue to create tomorrow's leaders who are deeply rooted in science and technology and contributing to the societal goals of the country.
Thank you. I request Director of IT Bombay, Professor Subhashish Chaudhary, to felicitate the Honorable President of India. I request Director of IT Bombay, Professor Subhashish Chaudhary, to felicitate Honorable Governor of Maharashtra, Shri Ramesh Bais ji. I now request Honorable President of India to dedicate the CAR-T cell therapy to the nation.
NexCar19 is a cutting-edge make-in-India innovation with curative potential in cancer and many other immune diseases. It is India's very first CAR-T cell therapy, a personalized and precise immunotherapy. The journey of innovation began almost 10 years ago at IIT Bombay, India's premier research institute. The concept of this transformative technology and revolutionary therapy was born in 2013 at the Biosciences and Bioengineering Department of IIT Bombay, when Professor Rahul Purwar and his team began researching on a way to fully indigenize cell and gene therapies to ensure their affordability and accessibility in India. His lab spent years developing a start-to-end novel product design and patented technology into a fully integrated gene therapy platform. Spearheaded by Dr. Hasmukh Jain and Dr. Gaurav Narula and their teams at Tata Memorial Centre, one of Asia's leading cancer hospitals, these clinical trials assessed NexCar19's potential across patients from all backgrounds. NexCar19's platform resulted in successful patents along with publications and articles in several renowned academic journals and mass media. Nature, the world's most prestigious scientific journal, applauded our Make in India efforts in yet another milestone for Indian innovation. Two students from IIT Bombay, Dr. Alka Dwivedi and Dr. Atharva Karolkar, began their entrepreneurial journey by creating ImmunoAct at Sign, an IIT Bombay incubator in a small one-room lab with Professor Rahul Purwar. The dream was to ensure access to this gene therapy to the masses occurs in hospitals across the country and to all socio-economic backgrounds, including the underprivileged. In collaboration with the visionary Dr. Satyanarayana Chava of Laurus Labs, our goal of scaling this technology became a reality, with its ubiquitous, affordable access resulting in a high social impact. NexCar19, manufactured at ImmunoAct's state-of-the-art GMP facility in Navi Mumbai with the highest quality standards, demonstrated high efficacy in pivotal clinical trials conducted across multiple hospitals, and an excellent safety profile across multiple clinical trials. In October 2023, the CDSCO approved NexCar19 as the country's first ever CAR T-cell therapy. It is a hallmark of the collective spirit of Indian innovation and a watershed moment in cancer care, designed to save millions of lives. NexCar19 marks a tectonic shift in moving India from a service and generics pharmaceutical giant to a leader in novel biological therapies, as we join the few elite group of countries where cell and gene therapies are accessible. NexCar19 is the world's most affordable CAR T-cell therapy at commercial scale and aims to be widely accessible, especially in lower and middle income territories for high social impact. NexCar19 will soon be available across India and successfully delivered to over 100 patients, including metropolitan, rural and tribal hospitals like SMBT Nasik in Maharashtra. Today, we celebrate a remarkable historic moment. Dedication of CAR T-cell therapy to nation by Honorable President of India. Humanized by us, personalized for you. A landmark of Indian ingenuity. Jai Hind.
मेरा नाम कुलदीप दुबे है। मैं मध्य प्रदेश गुना से हूँ। मैं एक लैब टेक्नीशियन हूँ। मेरी उम्र है 44 साल। कैंसर अगर डिटेक्ट हो गया तो ऐसा कुछ नहीं है कि इसका कोई उपाय नहीं है। आजकल बहुत सारी चीजें अच्छी से अच्छी थेरेपी आ चुकी है। अब तो ये CAR T-सेल भी आ गई है, तो हमें काफी उम्मीद की किरण जग गई है। शुरुआत में एक डॉक्टर से मिला, वहाँ के जो भी MD मेडिसिन, तो उन्होंने 3-4 दिन का मुझे ट्रीटमेंट दिया। तो 3-4 दिन बाद देखा तो लिम्फोसाइट और मतलब 11,000 से 44,000 पे पहुंच गए थे। तो वहाँ पे जाते जाते और हीमोग्लोबिन कम हो गया। फिर बोन मैरो टेस्ट किया तो उसमें डिटेक्ट हुआ कपूर ब्लड कैंसर। तो फिर मैं सीधा टाटा मेमोरियल आया। तो मेरा कीमोथेरेपी हुआ था, करीब मतलब 1 साल का पीरियड रहा मुझे कीमोथेरेपी पूरा कंप्लीट लेने में। सर अभी 2023 में 1 जनवरी को मुझे दोबारा से रिलैप्स हुआ। वही फीवर आया, खांसी वगैरह तो तकलीफ हुई, तो जांच किया, फिर वही लिम्फोसाइट बढ़ना चालू हुआ। तो यहाँ पर फिर से रिलैप्स निकला, तो उन्होंने डॉक्टर हसमुख जैन के लिए रेफर किया कि वहाँ पर आप जाइए। तो आगे और फिर उन्होंने ये एक तरीका ये बताया, CAR T-सेल का ये अभी नया आया है, तो इसका पूरा डिटेल उन्होंने मुझे समझाया कि आप ऐसे भी कर सकते हैं जैसे आप। तो फिर मैंने CAR T-सेल में जाना पसंद किया, पर ऐसा नहीं घबरा करके इसमें नहीं जाने से, लड़ना है हमको और आगे काफी लंबी उम्र मिल पाएगी।
Now, we will be taking NexCar19 to the global society. with the aim to expand access to this therapy across the world and to all territories with a critically unmet need.
We have created an ecosystem in the country to develop novel gene therapies. With this new platform technology, now we can develop many more products and many more therapies quickly. This project now will have huge potential in curing many different types of diseases and save millions of lives across the world.
NexCar19 will soon be available across India and successfully delivered to over 100 patients and potential to save millions of lives.
Thank you. I now request Professor Sudeep Gupta, Director of TMC, to address the audience.
Honorable President of India, Srimati Droupadi Murmu ji, Honorable Governor of Maharashtra, Shri Ramesh Bais ji, Director of IIT Bombay, Professor Subhashish Chaudhary, esteemed guests, colleagues, ladies and gentlemen. It is my singular honor and privilege to represent the Tata Memorial Center today in this program to dedicate a new cancer treatment, the CAR T-cell therapy NexCar19, to our nation and the world. On behalf of the Tata Memorial Center, which is an institution under the Department of Atomic Energy, the Government of India, I would like to express our deepest gratitude to the Honorable President of India for her esteemed presence among us. Madam, your encouragement and blessings for our work will be a lasting source of inspiration for the staff members of Tata Memorial Center, many of whom are present in the audience, and will motivate us to continue our efforts in the service of our nation. I would also like to express our gratitude to the Honorable Governor of Maharashtra for his esteemed presence and acknowledgement of our institution's contribution. The creation and rollout of NexCar19 is a historic milestone in the fields of cancer care and genetic engineering. It is a testament to the dedicated collaborative efforts of scientists, doctors and other staff members of IIT Bombay and Tata Memorial Center. This treatment is not only a scientific achievement of the highest order, but also has immense practical application. At Tata Memorial Center, we know how meaningful it is to save every life and wipe every tear. NexCar19 will save many, many lives and wipe many, many tears. CAR T-cell therapy has been an enormously expensive treatment which is out of the reach of an overwhelming majority of patients who need it worldwide. NexCar19 has been rolled out at approximately 1/10 of the price at which it is available outside India. This is especially noteworthy because NexCar19 needs to be custom manufactured for every patient under the most stringent conditions. All new cancer treatments need to travel a long road from invention to preclinical testing in cell lines and animal models to several phases of human clinical trials before they are approved for routine use in human patients. This journey can often be long and arduous. It is to the credit of the collaborating teams from IIT Bombay and TMC that this journey could be completed in less than a decade. Our collaboration has not only resulted in this sophisticated therapy, but also provided proof that Indian institutions can collaborate and work towards a common goal. It is one further step in our common mission of an Atmanirbhar Bharat and one further step in our mission to be a developed nation, Viksit Bharat, in every meaning of that term by the year 2047. On behalf of Tata Memorial Center, we would like to thank IIT Bombay for believing in our ability to undertake the full clinical development of NexCar19. The first patient to receive a CAR-T treatment in India was a child with leukemia on 4th June 2021 at Tata Memorial Center, with the product made in IIT Bombay. The phenomenal speed and efficiency in completing clinical trials for lymphomas and leukemias have resulted in approval for market authorization on 13th October 2023, a truly historic milestone. I would like to place on record our grateful thanks to our parent, the Department of Atomic Energy, for their unflinching support in all our endeavors. At Tata Memorial Center, within our 11 hospitals in 7 states of India, we register about 125,000 new cancer patients every year, which represents almost 1/10 of the annual cancer incidence in India. Honorable President of India, Madam, we would like to assure you that we will continue to strive to our fullest with every ounce of our energy to ensure that cancer care is delivered to every patient in India regardless of their ability to pay. We will also continue to engage in research and innovation that is practical, cost-effective, and immediately implementable in every corner of our country. Finally, at Tata Memorial Center, our patients are the reason for our existence as an institution. To them who trust us with their lives, we bow in gratitude. Thank you very much for your attention. Jai Hind.
Thank you, Professor Gupta. I now request Honorable Governor of Maharashtra, Shri Ramesh Baisji, to kindly address the audience.
भारत के माननीय राष्ट्रपति के कर कमलों द्वारा कैंसर के इलाज के लिए भारत की पहली एकीकृत स्वदेशी CAR-T सेल थेरेपी NexCar19 का शुभारंभ के अवसर पर कार्यक्रम में उपस्थित महामहिम श्रीमती द्रौपदी मुर्मू जी, भारत के माननीय राष्ट्रपति, सुभाषिष चौधरी जी, निर्देशक, भारतीय प्रौद्योगिकी संस्थान मुंबई, डॉक्टर सुदीप गुप्ता जी, निर्देशक, टाटा मेमोरियल हॉस्पिटल, सभी विशिष्ट अतिथिगण, IIT मुंबई तथा टाटा मेमोरियल सेंटर और हॉस्पिटल के विशेषज्ञ, अध्यापक, शोधकर्मी तथा छात्र छात्राएं, सबसे पहले मैं भारत के माननीय राष्ट्रपति श्रीमती द्रौपदी मुर्मू जी का महाराष्ट्र राज्य में हार्दिक स्वागत करता हूं। आज का दिन देश के लिए और विशेष रूप से IIT मुंबई और टाटा मेमोरियल हॉस्पिटल के इतिहास में एक महत्वपूर्ण दिन है। देश के दोनों शीर्ष संस्थानों द्वारा चिकित्सा विज्ञान के क्षेत्र में अद्भुत पहल का आज शुभारंभ हो रहा है। आज हम न केवल एक नई कैंसर ट्रीटमेंट प्रणाली का लोकार्पण कर रहे हैं, जो कुछ प्रकार के कैंसर के इलाज में मदद कर सकते हैं, बल्कि एक यशोगाथा भी दुनिया के सामने ला रहे हैं, जो विकसित भारत के हमारे लक्ष्य को साकार करने की दिशा में एक ठोस कदम है। इस उत्कृष्ट उपलब्धि पर मैं IIT बॉम्बे और टाटा मेमोरियल सेंटर को बधाई देता हूं। साथ ही इस परियोजना में सहयोग के लिए उद्योग भागीदारों को भी बधाई देता हूं। कुछ महीने पहले टाटा मेमोरियल अस्पताल के साथ कार्य कर रहे NGO के सदस्य कैंसर पीड़ित छोटे बच्चों के साथ राजभवन आए थे। कैंसर का इलाज करा रहे छोटे छोटे लड़के लड़कियों के मासूम चेहरे देखकर मुझे काफी दुख हुआ। जो उम्र खेलने का है, बच्चे बीमारी से जूझ रहे हैं। आमतौर पर तंबाकू से जुड़े उत्पादों के सेवन से लोगों को कैंसर होता है, ऐसी हमारी धारणा होती है, लेकिन इन बच्चों में तो ऐसी कोई आदत नहीं होती, फिर भी वे ब्लड कैंसर जैसे गंभीर बीमारियों से पीड़ित हो जाते हैं। छोटे बच्चों के साथ उनके माता पिता को कितने कष्ट होते हैं, इसकी कल्पना भी नहीं कर सकते। वर्ष 2025 तक देश में कैंसर के मामले 15.7 लाख तक पहुंचने का अनुमान है। CAR-T सेल थेरेपी न केवल बुजुर्ग कैंसर रोगियों के लिए बल्कि महत्वपूर्ण रूप से बाल कैंसर रोगियों के लिए एक वरदान के रूप में आई है। हमें इस थेरेपी को जरूरतमंद लोगों तक पहुंचाना होगा, साथ ही इसे सभी प्रकार के किफायती बनाने के लिए हर संभव प्रयास करना होगा। नोबेल पुरस्कार विजेता भारतीय वैज्ञानिक CV रमन ने कहा था, विज्ञान को प्रयोगशाला की 4 दीवारों तक ही सीमित नहीं रहना चाहिए, बल्कि इसे हमारे जीवन के सभी पहलुओं में समाहित करना चाहिए। आज की उपलब्धि इस बात का प्रमाण है कि भारतीय विज्ञान प्रयोगशाला की दीवारों को तोड़ रहा है। हाल ही के वर्षों में पूरे विश्व ने भारत को दुनिया के टीकाकरण केंद्र के रूप में मान्यता दी है, जिसने DNA कोविड वैक्सीन, दुनिया का पहला इंट्रानेजल वैक्सीन कोविड वैक्सीन और भारत का पहला स्वदेशी रूप से विकसित वैक्सीन सर्वाइकल कैंसर की रोकथाम के लिए वैक्सीन और कई अन्य टीके तैयार किए हैं। हमारे देश में चिकित्सा में नवाचार के कारण लोगों के जीवन काल में वृद्धि हो रही है। भारत को अमृत काल के दौरान द्विध्रुव चुनौती का सामना करना पड़ेगा। हमारी 70% से अधिक जनसंख्या 40 वर्ष से कम उम्र की है और दूसरी ओर हमारे यहाँ बुजुर्ग आबादी नियंत्रण बढ़ रही है। इस प्रकार हमारे सामने बीमारियों के प्रसार को रोकने के साथ साथ अक्षमता को रोकने की दोहरी चुनौती है। किसी भी उन्नत देश में शिक्षा, उद्योग, सहयोग प्रमुख आधारशिला है। आज भारत दोनों संकेतों पर अच्छा प्रदर्शन कर रहा है। विकसित भारत को यह भी ध्यान रखना होगा कि हमारी सेवाएं दुनिया में सर्वश्रेष्ठ हो। आने वाले दशकों में स्वास्थ्य सुरक्षा स्वयं एवं नवाचार के साथ एक बड़े बदलाव से गुजरेगा। हमारे सामने कुछ विशिष्ट चुनौतियां भी है जिनका हमें समाधान ढूंढना होगा। महाराष्ट्र, तेलंगाना और छत्तीसगढ़ राज्यों में सिकल सेल एनीमिया की समस्या बनी हुई है। सिकल जीन विदर्भ में व्यापक रूप से फैला हुआ है। खासकर आदिवासी समुदायों के बीच हमारी वैज्ञानिक बिरादरी को अनुसंधान और विकास के माध्यम से इस समस्या के लिए एक स्थायी समाधान खोजने पर काम करना चाहिए। यह प्रसन्नता की बात है कि सेल और जीन थेरेपी कैंसर के इलाज से लेकर सिकल सेल एनीमिया जैसे आनुवांशिक विकारों और बढ़ती आबादी के साथ आने वाली कई अन्य चुनौतियों का एक महत्वपूर्ण पहलू होगी। भारत दुनिया की मधुमेह राजधानी के रूप में उभरा है। 2023 में प्रकाशित भारतीय चिकित्सा अनुसंधान परिषद भारत मधुमेह ICMR इंडिया भी अध्ययन के अनुसार मधुमेह की व्यापकता 10.1 करोड़ है, जबकि सरकार बीमारी की रोकथाम और उपचार के पहलुओं पर काम कर रही है। हमें मधुमेह और अन्य जीवन शैली से जुड़ी बीमारियों से निपटने के लिए गहन शोध की आवश्यकता है। एक पखवाड़े पहले मेरी भारत के सभी 23 IIT के रजिस्ट्रारों के साथ बैठक हुई थी। अच्छा होगा अगर हर IIT एक इनोवेशन लेकर आए। इससे भारत को 2047 से काफी पहले विकसित भारत बनने में मदद मिलेगी। आर्टिफिशियल इंटेलिजेंस और मशीन लर्निंग में चिकित्सा निदान के क्षेत्र में क्रांति लाने की क्षमता है। मशीन लर्निंग तकनीकों का लाभ उठाकर AI बीमारियों का निदान करने, फ्रैक्चर, ट्यूमर या अन्य स्थितियों का पता लगाने में मदद कर सकता है, जिससे तेज और अधिक सटीक चिकित्सा निदान होगा। आज का इस दिन IIT मुंबई और टाटा मेमोरियल हॉस्पिटल को CAR-T सेल थेरेपी के सफल लॉन्च के लिए बधाई देते हुए मैं उनसे कहना चाहूंगा कि हमें आपसे बहुत उम्मीदें हैं। जय हिंद, जय महाराष्ट्र, जय विज्ञान, जय अनुसंधान।
Thank you, sir. I now request Honorable President of India, Srimati Droupadi Murmu ji, to kindly address the audience.
Governor of Maharashtra, Shri Ramesh Baisi ji, Director, Tata Memorial Center, Professor Sudip Gupta ji, Director, IIT Bombay, Professor Subhashish Chaudhary ji, distinguished guests, ladies and gentlemen, Namaskar. I am indeed glad to be here among you today because the occasion is truly historic. The launch ceremony of India's first gene therapy is a major breakthrough in our battle against cancer. As this line of treatment named CAR-T cell therapy is accessible and affordable, it provides a new hope for the whole of humankind. I am sure it will be successful in giving new lives to countless patients. Everyone associated with this humanistic initiative deserves congratulations. CAR-T cell therapy or chimeric antigen receptor T cell therapy is a form of immunotherapy and gene therapy. It requires complex genetic engineering to modify the patient's immune cells, especially T cells, and make them fight cancer. CAR-T cell therapy is considered to be one of the most phenomenal advances in medical science. It has been available in the developed nations for some time, but it is extremely costly and beyond the reach of most patients around the world. What is new about the therapy being launched today, as I understand it, is that it costs 90% less than what is available elsewhere. I am told that this is the world's most affordable CAR-T cell therapy. Moreover, it is also an example of the Make in India initiative, a shining example of Atmanirbhar Bharat. The development of this therapy in India over the past decade and its approval in October 2023 speaks volumes about the skills of Indian scientists and physicians. India's first CAR-T cell therapy is developed through collaboration between the Indian Institute of Technology Bombay and Tata Memorial Hospital in association with industry partner ImmunoACT. So, we have two of institutes, India's final research institutes in their respective fields, joining hands with industry for a humanitarian cause. This is a praiseworthy example of academia-industry partnership, which should inspire many more similar efforts. I am told that ImmunoACT is a startup of two students, Alka Dwivedi and Atharva Karulkar, and Professor Rahul Parwar of IIT Bombay. Their vision and the hard work they put in to actualize that vision are commendable. Ladies and gentlemen, since the beginning of the civilization, we have made unbelievable progress in various walks of life. In the recent centuries, science has helped us treat a variety of diseases. There used to be many life-threatening ailments that have been wiped out and forgotten now. Cancer, however, remains one of those complications that remind us of our limits. It has claimed a large number of lives around the world. In India, 14.6 lakh people succumbed to it in 2022, and the number is likely to rise to 15.7 lakh by 2025. We can only imagine the pain and suffering of so many patients and their families. Yet, there is no room for pessimism. How can there be when we have succeeded against so many diseases? Inspired by the history of so many successful battles scientists are battling on. With early diagnosis and timely intervention, more and more people have been cured. Their success, in turn, motivates others in creating a positive mindset. It is through such slow but incremental steps that we will overcome the demon of cancer. The therapy being launched today is, of course, a major step, in fact, a new milestone in the journey of healthcare innovation in India. It puts us on the global map of advanced medical care as well as on the elite list of countries which have access to this most innovative technology platform. I gather it has already received high praise from experts abroad. What we have before us is also an inspiring example of making academic research practical and viable. I am told this therapy will be available across the country in major center hospitals, providing new hope to patients and their families. Moreover, this affordable treatment can be made available to all patients across the world. That will be in tune with our vision of Vasudhaiva Kutumbakam. Ladies and gentlemen, the Indian Institute of Technology together form a glorious chapter in the saga of modern India. IIT Bombay, in particular, has been the pride of our education as well as technology sectors. In the National Institutional Ranking Framework 2023, this institute was placed 4th overall and 3rd in engineering. The reputation of its faculty and the caliber of its students are outstanding. It was accorded the status of an institution of eminence by the government. When I learned about the new therapy being launched today, I was pleasantly surprised because IIT Bombay is renowned not only in India but across the world as a model of technology education. Here, in this case, technology is not only being put in the service of humanity, but partnership have been with an eminent institution from another field as well as with industry. This has been made possible by the focus IIT Bombay has placed on research and development over the last 3 decades. IIT Bombay has been setting up several centers of excellence and technology incubators. Investing funds received from the government as an institute of eminence, it has established cutting-edge research and development facilities. As a result, Bombay IIT has earned a significant number of intellectual property rights too. Its key research areas include artificial intelligence, machine learning, and Industry 4.0 technologies, among others. These are the advances that are shaping our tomorrow. The pace of change is rapid, and often the challenges it poses before the society are daunting. but with the knowledge base and skills of the faculty and students of IIT Bombay and other similar institutions, I am sure India as a whole will benefit greatly for the technological revolution underway. Ladies and gentlemen, let me conclude by once again congratulating the individuals directly responsible for the new therapy being launched today, as well as the institutions and people associated with them. Your visionary intervention is going to save precious lives and make so many families smile again. Your initiative will inspire others and will go a long way in realizing the wish expressed in our well-known prayer, Sarve Bhavantu Sukhino, Sarve Santu Nirmaya, Sarve Bhadrani Pashyantu, Ma Kaschid Dukha Bhagya Bhavet. Thank you. Jai Hind, Jai Bharat.
Dhanyavad, Manniya Rashtrapati Ji. I request all of you to kindly stand up for the national anthem. Thank you. Please join us for refreshments.